Thank you very much for accepting this invite. This one is going to be led by Manette, so I'll give her the lead, and I'll be just the guest for this session.
Super.
So I think we're waiting for Federico, and I'm pretty sure he will join soon, but I'm going to make a start of it. So just to introduce myself, my name is Manette. I'm the Corporate Social Responsibility Lead for Servier. Today I'm really honored to introduce to you ACT4Children. It's a collaborative initiative dedicated to improving cure rates for children with cancer in low and middle income countries through pragmatic, measurable, and sustainable solutions. And as ACT4Children is a collaboration, I brought some key collaborators here to meet today as well to share more about this initiative. Dr. Scott Howard, pediatric oncologist and CEO of Resonance, Dr. Gevorg Tamamyan, which you all know, I'm sure, editor-in-chief of OncoDaily, Dr. Federico Antillón as well, the dean of the medical school at the Francisco Marroquín University in Guatemala. So the strength of ACT4Children really lies in its partners.
And Sean Lybrand.
And Sean Lybrand. Sean, what is your title exactly?
Yes, thank you. Executive Director, Access to Healthcare. Access to Healthcare is a team within Amgen that focuses on low and middle income countries in which we do not have a presence, primarily sub-Saharan Africa and selected countries in Asia.
Thank you so much. So to give you a little bit of a flavor of ACT4Children, it's an initiative, a collaboration, and its strength, as I said, of this initiative lies really within its partners, where each play a critical role in improving a child's chance to cure. Our growing alliance includes the International Society of Pediatric Oncology, World Childhood Cancer International, IDA Foundation, Resonance, Julian Hematology and Oncology Center in Armenia, Unidad Nacional Oncology Pediatric, the UNOP in Guatemala, the Centro Médico Ayudame Aviver in San Salvador, OncoDaily, and Servier. Each partner really contributes uniquely. For instance, Servier gives innovative child cancer medicines for pediatric leukemia, ensuring access to life-saving treatments while also supporting best-in-class clinical management. More partners are joining this initiative, and the number of collaborators continues to grow. And this aligns with also the WHO cure-all goal to improve survival rates for children with cancer in low and middle income countries to at least 60% by 2030. Scott, I have a question for you. What do you think makes ACT4Children a unique initiative or collaboration?
Well, it is great to be with you, and I really appreciate Gevorg. Thank you for creating Oncothon and for hosting us. Really appreciate it. ACT4Children is, for me, the next step in what we have to do to help children with cancer all over the world. It is a pragmatic, hospital-based approach to make sure every child doesn't just get access to medicines, but actually everything they need to be cured. Medicines are essential, critical, absolutely prerequisite to even thinking about cure, but we also need timely diagnosis. We need correct diagnosis. We need access to all the other therapies, radiation, surgery, supportive care. We need trained healthcare professionals. We need nutritional support. We need the health system strengthening and long-term sustainability. And I think we all realize long-term sustainability is not just one NGO. It's not one pharma company. It's not one media company. It's not one hospital. It's got to be all of us together with the government and all of us supporting the government to deliver health to the citizens. So I really like, for me, the ACT4Children, the special sauce here is working directly with hospitals with adapted strategies to support each hospital to take its next steps in all from A to Z, diagnosing to curing a child. And so part of that is basically making it measurable and tangible and adapted specifically to each situation. So I'm really proud to be sitting here with all of you.
Thank you so much. In January, we were in Armenia and we saw firsthand the impact of ACT4Children on patients and families and physicians. Let's take a moment and see some of the footage that showcase this collective effort to make a real difference. ACT4Children started with a vision to change the world for low and middle income country children, to remove the financial barrier to access for quality medicines.
What we all strive for is the best and equal access of best medication for all the children around the world. And countries like Armenia really do have a lot of struggles.
It has to be access and access to high quality, because access to low quality might sometimes be worse than just nothing at all.
We need well-attested medicines, which are very expensive for us.
Quality medicine is not the cure-all of everything. It requires a very dedicated medical team, a very dedicated patient support structure.
Launching the ACT4Children programs makes me happy every minute of every day. It's a whole group of collaborators, oncologists, nurses, pharmacists, social workers, patient navigators.
Հիմնադրամը ջանք ու եռանչի խնայում ավելի մեծ լսարանի հասցնելու ուղղությամբ մեր այն ընտանիքների, որոնց երեխեքի մոտ կողմից ինչը անգնահատելի աջակցություն է. What we value a lot is to have the same access to medication, the same access to quality care as children all over the world.
Every partner can bring their excellence to the table, and together we can improve child cancer outcomes. Gevorg, for you, Armenia is close to your heart, I know, because it's your home country. How do you see ACT4Children making a difference for children in Armenia?
Thank you for the question, Manette, and thanks for the work, for the great work. Armenia is a small and very beautiful country, but I mean, being small, it has its own challenges. One of the challenges is that the small countries are not interested for the many big pharma companies in terms of, I mean, the market is quite small, especially in pediatric oncology when it's a rare and orphan. These are rare and orphan diseases. That's why many companies, they don't come and register the drugs themselves in the countries like ours. This is one of the problems, which means, I mean, many of the times you don't have the proof of the quality itself. This is one of the problems. The second problem, Armenia is a low and middle income country, and many innovative medicines are quite expensive. The treatment itself, it's covered by the foundation. The City of Smile Foundation is covering almost all the treatment costs. But of course, with the new drugs, the prices is going up, and I mean, it's getting more and more difficult to get these medications. I mean, we are covering, certainly. There is no single child in Armenia who would left without treatment. But certainly, I mean, it's going to be more and more difficult to have this without the support from the pharma. That's why I mean the ACT4Children is important to have this platform for the cooperation between the pharma, between the hospitals, between the international society, and the main stakeholders. I mean, we need to have a valid and effective tools for the cooperation between the pharma and the other stakeholders, I mean, the people working on the field. That's why I think it is important, not only for Armenia, but also elsewhere.
Thank you very much, Gevorg. This week, ACT4Children is in Guatemala, where the pediatric oncology healthcare team, the oncologists, nurses, data managers, and more participated in hands-on, in-person SIOP Global Academy for ALL and World Child Cancer Training. Federico, can you share how this hospital-based training you think is equipping the team at UNOP to improve childhood cancer care in Guatemala?
And good day to all. It's an honor to be here at the Second Global Oncothon, advocating for children with cancer. Definitely, this hospital-based training provided through ACT for children is going to make a direct input on how we diagnose, treat, and manage children here at UNOP in Guatemala. This is not just theory, it's really hands-on because as you know, Manette, Scott, and ACT team have been here in Guatemala since Wednesday, training our entire team. Not only focuses on the doctors, but also on the data managers, the nurses, and all these essential staff to ensure that every aspect of the patient it's enforced and straightened. The hospital-to-hospital model is especially powerful. We are learning directly from experienced centers that have been successfully improved cure rates around the world, and we adapt them. We tropicalize him here in Guatemala, and we're ready to implement them. So we're very grateful as a team. Thank you very much.
Thank you, Federico. And I also feel very privileged today to be with an industry colleague on a talk like this. Sean, from your perspective, where do you see the pharmaceutical industry fit in this drive to improve child cancer outcomes in poor resourced or low middle income countries?
Thanks, Manette, and thanks, of course, to OncoDaily and to SIOP for the invitation. And I would also like to congratulate Servier and residents and to the sites on the ACT4Children program. This is such an incredible parallel step forward to other actions that are really bringing a focus to childhood cancer. So we have, as I said at the beginning, a group called Access to Healthcare, and our focus is low and middle income countries in which Amgen doesn't have a presence. And everybody is a part of the solution with respect to cancer and health outcomes, to childhood cancer and childhood outcomes. Companies like ours have very effective medicines which work incredibly well in the healthcare systems that are built around universal health coverage. And as Gevorg said, in lower resource settings, there is often not the presence of universal health coverage, and therefore the total complement of care is often lacking. And even the world's best pharmaceutical medicine won't work in a system where the system itself isn't ready for it, doesn't have the right diagnostics, doesn't have the right pathology. So pharmaceuticals are a part of a larger method and management of care that the pediatric oncology doctors, nurses, and healthcare teams undertake in support. So a number of the initiatives that we are taking as an organisation seek to support that. There is hardly a work day and certainly no work week that goes past where myself and my team is not focused on childhood cancer care and childhood cancer outcomes. And even in the last 10 years, as Scott and others will be able to attest, the outcomes, the progress and the survival for children living with childhood cancer have improved greatly. We are focusing both on bottom-up and top-down approaches. So top-down, as an example, submissions to the WHO Essential Medicines List to see medicines added that lead to better outcomes for children living with cancer, and the ability for lower resource income settings to be able to consider those medicines for adoption on their national medicines list. We work on health systems strengthening with organisations like World Child Cancer in a program that focuses on B-cell lymphomas and a very specific focus on Burkitt lymphoma. And we're very pleased to see initiatives like both the WHO's Global Initiative for Childhood Cancer and also the WHO and St Jude Children's Research Hospital collaboration on the global platform for access to childhood cancer medicines, which is launching as we speak in the first 6 countries and over the next 5 years will support up to 50 countries with cancer medicines access, which when the medicines are there, the systems can also be built around them. So this is a real message of hope, I think, on Childhood Cancer Awareness Day for progress towards better outcomes for kids living with cancer.
Thank you very much, Sean. So, Sean, Gevorg, Federico, and everybody in this community, all of the partners, World Childhood Cancer International, IDA Foundation, everybody working together, a big thank you for this commitment to improving childhood cancer care globally. And as you can see, your donations to SIOP play a direct and vital role in catalyzing high-quality care for children with cancer. By supporting SIOP, you are giving children the best possible chance for a cure and a future filled with hope. Every contribution makes a difference. Thank you for being part of this mission.
Thank you so much, Manette, and thank you everyone, Sean, Federico, Scott. Thank you everyone for joining the Oncothon. I'll use this opportunity also to say a few more thanks. Again, thanks a lot for initiating ACT4Children. This is going to be really a change maker, and I'm sure it's going to be very successful. And thanks a lot, Manette, for all your contributions, and to Servier for moving this forward. I'll use this opportunity also to thank Sean and Amgen for their support as well. Recently, we started the Global Health Dialogues with Princess Dina on OncoDaily, and Amgen was the first to support this initiative, and it's going right now quite well. And like you mentioned about the contributions, I'll remind everyone and who is watching us as well that in the morning, early morning, Her Royal Highness Princess Dina, she started challenge, Oncothon challenge. So she donated $10 to the SIOP and challenged 3 of her friends to do the same, to donate again $10, and each of them to challenge 3 of their friends to do the same. And I mentioned today again that I made a simple calculation. If it starts only from 1 person and it goes that way, $10 challenging 3 people, then again $10 challenging 3 people, it takes 13 rounds, only 13 people, like 13 levels, to get 10 million or more, with $10 only. So I will encourage, and of course, if it's widespread, if it's like many people are, like, let's say, for example, 100 people are doing the same challenge and the chain is not broken, I mean, it's going to be viral. That's why I will ask everyone who is following us, also our speakers who want to support that way, just like to build their own challenge. And by giving $10 to SIOP and challenging 3 their friends, who will be the friends who will not break the chain? This is the most important part, to continue that way. And I'm sure this way we will make a difference. The Oncothon, we started today early, like it's already 12 hours it's going, the Oncothon, but it's just the beginning. This challenge will continue. And I think, the plan is that it's going to continue quite long. And of course, I think today it's going to be more active, but afterwards also there is going to be a lot of work to do. And I think we will conclude the results during the Childhood Cancer Awareness Month in September to see how much actually we made it. And the foundations themselves, they are also being part of this challenge. In the morning, Dean Crowe, a good friend from the president of Raleigh Foundation, she challenged the foundations and philanthropists with the 100K contribution and to do the same. So let's see how it goes. But even the small contributions are going to make a difference. Thank you very much again for all your contributions. Before we closing the session, would anyone want to add something?
Sure. I want to thank again Manette, Sin, Gevorg, Scott for this great initiative. I think ACT, as we say in Spanish, is a rompeaguas. It's a before and an after event. This is going to be huge. So thank you very much.
Thank you so
Thank you very much. And Dr. Federico Antillón, also he is the co-chair for the GHN network of the largest network of SIOP, and he is raising all these issues and trying to solve all the global health network. So, I mean, he knows very well the importance of supporting research.
Thank you so much, Gevorg. Yeah, indeed.
And good luck.
Thanks,
Best
Gevorg.
wishes, Gevorg, for the next 12 hours. Sean.
Here's my 10, and I'm going to call 3 people.
Thank you so much. Thank you very much. Wonderful. Looking forward to that.